everybody, my name is Pauline Valeza. I am a student nurse of Catanduanes State University. So I am going to demonstrate to you how to perform LEOPOLD'S maneuver. It has basically four specific steps in order to palpate the uterus through the abdomen in order to determine the lie, position, presentation of the fetus inside the uterus. So this method of abdominal palpation is probably of low cost, easy to perform, and non-invasive. So it is used to determine, like what I have said, explain the method of systematic abdominal palpation used to assess fetal presentation and position in the third trimester of pregnancy. So yes, you heard it right. LEOPOLD'S maneuver are performed after 24 weeks of gestation. So after 24 weeks, 26 weeks of gestation. So basically, we have to know the fundamental things in doing such procedure. Number 1, introduce yourself. Number 2, explain the procedure and why it is necessary. So we have to explain the procedure to the mama in order to reduce the anxiety and for them to be comfortable. So number 3, observe proper hygiene. So in performing a procedure, you have to basically wash your hands, perform hand washing, or wear gloves, sterile gloves or clean gloves, wearing of PPEs, face masks, depending upon the procedure that you are going to do. Next is to ask consent. So, ma'am, sir, can I ask or can I have a permission? So you're going to ask the mom or the client, ma'am, sir, can I ask your permission in performing such procedures? And for example, the mother will say, or the patient will say, yes, okay, it's okay for me, okay. So, okay, ma'am. In performing LEOPOLD'S maneuver, before is we have to ask the mother to empty the bladder. So, the patient should be advised to void as an empty bladder because it promotes and allows for more productive examination, and the distended bladder can be obscure fetal contour. Next is to inquire the client's history. So you may ask while performing the procedure what are the history or the client's history. Prior to performing the procedure, you have to ask whether they have undergone surgeries, operations, or clinical checkups. We have to note. Another, we are going to provide privacy for the patient. So in providing privacy, maybe the curtains, you have to close the curtains or lock the door. Next is to prepare the equipment. So prior in performing the procedure, I already prepared the equipment. So the equipment in performing LEOPOLD'S maneuver are the measuring tape. We're going to use the length in centimeters. Pinard stethoscope or the Doppler transducer. Observe that the equipment is within the proximity. Next is we have to position the patient. So the position of the patient should be in a supine position with the head of the bed raised to 15 degrees and a small pillow or rolled towel placed on her left side. Next is to drape the mother to maintain privacy. So adequate exposure of the gravid abdomen from the substernum to the pubic symphysis. So just from the upper side of the abdomen and to the pubic symphysis. That's just the part where we can expose the tummy of the mama. Inspect the abdomen of the mama. Note if there are any lesions or scars from previous operations, cesareans, and other surgical operations undergone by mama. We have to warm our hands by rubbing it. Because rubbing our hands, cold hands can stimulate uterine contraction. In palpating the mother or the tummy of the mama, we have to use the palm of our hands, not our fingers, but the palm. We can now perform the 4 specific steps of Leopold's maneuver. The first maneuver, also called the fundal grip. So it assesses the uterine fundus to determine its height and which fetal pole, that is cephalic or pedalic, occupies the fundus. So in performing the first maneuver or the fundal grip, so we have to place on the right side of the mother, facing the mama. So the first maneuver aims to determine the gestational age and the fetal height. So gestational age can be evaluated using the fundal height or the McDonald's rule. So the uterine fundus reaches the pubic symphysis at the 12th week, a point midway between the pubic symphysis and the transverse umbilical plane at the 16th week, and on the transverse umbilical plane at the 20th week. And then having crossed this line, it is assumed each transverse finger's width corresponds to 2 weeks. And then we have to form both our hands like a mountain or like a triangular shape. And we have to place these both hands on each upper quadrant of the patient's abdomen, of the mama abdomen, facing the maternal xiphoid cartilage. So using the fingertips, the fundus is gently palpated to identify which fetal is gently palpated, the upper pole or the fundus of the uterus. Normal finding should be the breech gives the sensation. So the breech gives the sensation of a large nodular mass, and its surface is uneven, non-malleable, and not very mobile. So whereas the head feels hard and round with smooth surface of uniform consistency, which is very mobile and malleable. In this finding, you can report LM1 or Leopold's maneuver 1 cephalic or LM2 breech, Leopold's maneuver 2 breech. Second maneuver, sometimes called the umbilical grip. So this involves palpation of the lateral uterine surfaces. This aims to determine in which side lies the fetal back. Still facing the mama, the maternal xiphoid cartilage, both hands slides down from the uterine fundus towards the lateral uterine doors. So we can perform like this. So we are going to place flat our hands parallel to each other because it allows us establishing if the fetus is longitudinal, transverse, or oblique situation. So in palpating the mama, it should be gentle but with deep pressure. In your hands to the left side, if you are supporting your hand on the left side, the other side should be palpating like that. And repeat, if you are steadily supporting on the right side, the left hand should be palpating the lateral walls of the uterus. So the normal finding should be as is. The fetal back is felt as continuous board-like structure, while the fetal limbs is felt as a knob-like structure or as multiple knob-like structures. So the third maneuver is also called the Pauline's grip. So the Pauline's grip aims to determine the presenting part of the fetus on the lower uterine segment. So to achieve this, we have to use the thumb and the finger or the index finger of the right hand close above the symphysis pubis. We have to grasp the lower portion of the uterine segment just above the symphysis. The normal findings should be the fetal head is felt as hard, globular balutable mass if floating, and non-balutable mass if engaged. From in this maneuver, we can report LM3 cephalic or LM3 breech. Lastly, the fourth maneuver. So this maneuver resembles the first maneuver. However, we are facing the mother or we are facing towards the maternal pelvis. So unlike in the first maneuver wherein we are facing the mother, in this procedure, in this maneuver, we are facing the feet of the mother. So the fourth maneuver, also the pelvic grip, the deep pelvic grip, aims to confirm the findings in the pelvic grip to know whether the presenting part is floating or engaged. So to determine the position of the cephalic prominence to the fetal back in order to determine the attitude of the head. So the fingertips of each hand are used to apply deep pressure from the outside to the inside and in cranial-caudal direction along the lower contour of the uterus towards the birth canal. So it is possible to identify the characteristics of the part presented and confirm the findings detected with the third Leopold's maneuver. So the fingers of both hands move gently along the sides of the uterus towards the pubis. The side where there is resistance to this descent of the fingers towards the pubis is larger. So the side where there is resistance to the descent of the fingers towards the pubis is larger than where the forehead is located. So if the head of the baby is well flexed, it should be on the opposite side from the back of the fetus. So if the head of the fetus is extended, however, the occiput is perceived and is on the same side of the spine. So it's possible to evaluate the degree of descent of the presented part and to realize if there are gaps, such as gaps, the proportions between this and the pelvic inlet. So this maneuvers identifies which presenting parts in the lower uterine pool. So to perceive how much of the cephalic extremity, which we recognize to be at the lower pool, descends into the birth canal. So if it is entirely external, then it has now confronted itself. If it is confronting itself or if it is ultimately descended, the fingers travel the upper contour of the cephalic and around the neck of the fetus. So completing the fourth maneuver with the so-called fifth. So completing the fourth maneuver with the so-called fifth maneuver, it can also allow the difference or the approximate distance between the presenting part and the maternal. So we can also allow the position or the approximate distance between the presenting part and the maternal pelvis. So hello everyone, I am again Pauline Valeza, your student nurse. Bye bye!